are folks concerned about asymptomatic workers coming back into the office? And should agencies be continue looking to minimize the numbers of individuals that are returning to make sure that they're still providing the services needed, but to kind of minimize the number of folks in the office? And I would turn to Ms. Wen or Ms. Hoppy or Mr. Davidson for that answer.
Well, this is Taylor. We understand that the health data is still alarming at this point. We see continuous inclines on a weekly basis of number of cases and number of fatalities being posted on the CDC website. And there's a lot of uncertainties about bringing employees back to work at full capacity. I don't know what phase you're in as regarding the return to work, but as we had mentioned, TRA has been working at 100% capacity, whether they're working at the plants or teleworking. So we've been very much productive. The decision really relies on health data. Within your local jurisdiction and within your, based on data that's provided by your health officials, survey those. Have a surveillance mechanism to be able to check that information daily and have direct contacts if you should have for your emergency, management offices. But that is strictly a discretion that each organization has. While the government is not forcing anybody to reopen their facilities, they're making a plea and making recommendations as long as you have those measures of safety and containment for your employees. So at this time, I think that this is kind of preliminary for us to make the assumption that everybody has to get back to work in a designated time. So when we talk about a phased approach, your phased approach could be longer than what the government is actually saying. It could be, it's based on the health data and it's based on your comfort level of bringing your employees back. But when you do impose those measures to bring employees back at a certain percentage capacity or 100%, make sure you continue to impose those safety measures, continue to impose the social distancing, have available hand sanitizers and PPEs for your employees. TRA has taken the measure of putting and preparing by putting up transparent, protective barriers in a lot of the common spaces. The reception area, when visitors come in or employees come in, has a enclosed sneeze guard. And, secretary or administrative workstations out in the hallways or in front of offices. We've also installed temporary protective barriers around their spaces as well. And then we also have, mask and travel size hand sanitizers for individuals. We also went ahead and also purchased, face shields for individuals if they had, additional concerns over, just having another layer of protection. So those are some of the measures that we've imposed to give some assurance. And I know that, there's still those uncertainties, but, practice, and we've read everywhere that, hand sanitizing and, hand washing is the most effective measure right now. So continue to encourage and educate your employees about that.
Excellent. Well, Ms. Wen, thank you very much. That was a great answer. And Greg, thank you. That was a great question. We've had another question come in from Jean Shawcroft in Utah. Jean is wondering, what is your recommendation for bringing employees back to the workplace who may be nervous or perhaps paranoid about the disease? Any recommendations from that perspective?
Julie, you want to answer that, or she might be having some problems with her audio. Excuse me. I assure you, this cough is not anything related. It's allergies.
Yeah. Julie, are
I'm
you?
But
sorry. Can you repeat the question, please?
Oh, absolutely. The question that came in was, what is your recommendation for bringing employees back to the workplace who may be nervous about either the spread of the disease or possibly contracting the disease?
Yeah, I think there's always going to be those worries. I think that you just have to do your best to reassure the employees that you're doing everything possible to protect them, with having the hand sanitizers, the masks, and maybe you consider bringing them back in the last phase. If they have particular fears, it could be that they're one of those vulnerable employees, an older employee or an employee who has existing health care issues. So I think you're just going to have to do your best to reassure them that you're doing everything possible to keep them safe.
I would also like to add to that because we talked about teleworking and we would like to, we admit that we have not utilized the benefits of teleworking up until this pandemic. And, this pandemic basically forced our hands to be able to implement that, but it's been greatly received. We have had to consider individuals or positions that are traditionally non-telework or non-commuting type positions that some type of modifications to their job to accommodate them to stay home. So, for instance, we may have administrative assistants that are needed at the office to kind of monitor the phone calls to different managers or different staff, or also do certain have certain functions that are kind of public facing. We had to modify some of those duties to implement maybe a rollout of our telephone systems directly to their cell phones. So whoever is calling them on the phone, it is actually rolling out directly automatically to their cell phones or even their home phones. So they can actually function to that capacity at home. So their job is not affected. And by the same time, also helping, with their concerns about mitigation, mitigation and their health exposure as well. So job modifications and just rely on the tools that you have. Work with your IT professionals and your IT leaders in making resources available to those employees as well.
Well, that's a phenomenal answer. I think it's great to. It's also a great question, and I think it highlights the importance of thinking about not just the some of the physical impacts that folks are dealing with, but also some of the the emotional side of this. This is obviously a stressful time for a lot of people. So I think being cognizant of employees' well-being, both physically and how they might be nervous about coming back into the office is a great consideration. We are getting close to the top of the hour, and so I wanted to just kind of touch on a couple things that I thought really stood out in the presentations, and get Taylor and Julie and Dan your thoughts on this. But it seems like one of the main things that you guys mentioned was preparedness, but also flexibility, and being able to have a plan, but also being able to pivot if things develop and go. A lot of folks may have had an emergency response plan, but maybe not a pandemic response plan. So being flexible in how you administer those things. And then also, it seemed like you also emphasized the importance and value of doing some things that are very common sense, like making sure that folks are, washing hands appropriately and have access to things like the hand sanitizer and things like that when they're coming back into the office, and separating folks. Are there any final thoughts that any of the panelists would like to leave us with today before we conclude today's call?
Well, no, you hit it right on the on the mark there, Ian, about the flexibility of having some type of preparedness plan. Most organizations have an emergency response program, and this may not be, having a pandemic plan does not mean that you have to spend hours to evaluate all those situations. And it could be a matter of just making it very simple and annexing these provisions into your current emergency response plan. So it may not, depending on the size of your organization, you can just have a one pager with some basic guidelines on what you're doing to, with those actionable steps. What your decision, what would drive your decisions. And so if you don't currently have a pandemic response plan, this may be a time to evaluate that, but at the same time, keep it simple, as I mentioned before. Be very flexible because this, situations on a pandemic changes. Health data changes every day. And, our government is instituting new information almost every week. Up to this point, the things have been changing and evolving. We're all learning through this situation. And so make sure your plans are flexible.
That's excellent, and I think flexibility is definitely the order of the day. We had actually one more question come in that I might also be on the panelists, and Dan, I think you'd probably be a great one to answer this one. But I also might open it up to our communications committee chair and vice chair if they're in a position to answer the call. The question that came in actually deals with customer service and comes from Annette in Idaho, and she asks, we've recently received some gruff regarding new procedures for entering our office. Our city has not necessarily published any guidelines, but we have instituted some steps to protect staff. Any suggestions on how to deal with somebody that might be a little bit gruff? And I know that in the water industry, we've got a lot of great people, but we do have some pretty strong personalities, and sometimes those personalities can be gruff. So I don't know if Jennifer, would you have some thoughts on that?
Yeah, hi, Ian. That's a great question. And, we do need to remember that those customer service folks are really on the front lines. And, what I'm seeing a lot of is very clear information posted on the agency website about how the interaction, will occur with customers. That's very important as things are changing so rapidly. We talked about this on the first and second webinars, but also making sure that information is physically posted at your facilities where, if customers are coming in at some point, that's all spelled out right on, your front doors. That's very important. And, a mechanism if folks are calling you, a way to get back with them, again, with the clear instructions about how the interaction is going to take place. I mean, that's sort of what I'm seeing across the board. And even with all of that, we've seen the news clips. People are kind of worked up. So, the first and foremost, doing what we can to calm customers and reinforce what you are doing to protect them and to keep the water flowing. And so many agencies are holding the line on costs or rate increases and the payment deferral. Those are all things that you're doing. So make sure those things are prominent also, so folks see that you're really part of the community, all trying to, work together.
Thank you, Jennifer. And I think that's great. Having people, posting that information both online if you have a website and also at the office itself, and then letting people know why you're doing it that way, why you're taking these precautions. It's not just to protect your health, but it's for their health, and it's also to make sure that you can continue providing the service that they need, which is going to be water supply, and to help make sure that it's available when they need it. It's a great answer. I think that we have gone a little bit beyond the top of the hour, but we felt it was important to do that given the importance of today's content. So we're going to go ahead and conclude. Before we do that, though, I just want to thank Dan Davidson, Taylor Huen, and Julie Hoppy again, and Kevin Ward for making Ms. Huen and Ms. Hoppy available. Also like to thank Jennifer Persyke and Ashley Metzger from our communications committee, who have been the catalyst to get these going. We have the first 2 webinars in the series are up on the NWRA website if you'd like to check those out. We'll also be posting this webinar as soon as we're able to download it and get it processed. If you have any questions in the meantime, please feel free to reach out. There's contact information on the website. You can also reach us at nwra@nwra.org. Thanks, everybody. Stay safe, and appreciate you taking the time to join us today. Y'all take care.